okay, so what is it going to take you to act? What is it going to take to make you, believe something's possible? And I didn't expect the answer, and what it was is, show us what it could look like. Vital signs is our attempt to start creating a picture of what some possible futures might be, of some positive things that are going on. The story that's up there right now is the story of what a really good patient-centered healthcare system could look like, and it's based on the experience I had with the death of my mother. While that's a horrible encounter, it was the most supportive care system that I've ever been involved with. It took care of my mom, it took care of me, and consequently she had a very peaceful, respectful death, and I didn't have to, fend off the industry trying to make sure that she had the kind of death she would have wanted. We want to paint that picture, so that's what it could look like. And there's legislation is not a painted picture. What we're doing now is just insane. It makes no sense. We pay nearly $8,000 a person for health care right now. And in return for that, we're ranked 37th in terms of overall health outcomes. I think we're like 12th in life expectancy, 27th in infant mortality. And we are not the best health care system in the world. We have some of the finest technology out there, but we do not have a system of care. And that's what CodeBlueNow is trying to change. And we're starting to do this by finding out what the people want. Nobody's ever asked the public what they want in a healthcare system. So we took a big risk as an organization, and we commissioned a market research survey in Iowa to find out what Iowans want. We chose Iowa because it's a presidential campaign, and if you want to get press and get attention, you have to start where the candidates are. So they're in Iowa. Washington State, where we are, we don't have an early primary. We're not a major electoral college state. Everybody can go whoop-de-doo, The CodeBlueNow Pulse Iowa was our first formal survey of what the public wants. And they want something that's affordable, that's safe, that's accessible. They want to have time with their doctors. Just listening to the 30 pages of open-ended comments from these people. They want our children taken care of. They want our elders taken care of. And they want to be able to, not be afraid of losing everything they have because of medical bills. They don't trust anybody very much. That was the hard part to read, who they would trust, because they've lost trust of the politicians to make a difference. They don't think the presidential election's going to help shape a future of American health care. And they don't trust Congress or the federal government to solve the problem. And it's that cynicism, and at the same time, hidden inside that cynicism is just kind of this inner hope that they hope is there. They want to have it. They want to make a difference. They want to have something that's working for them. And the thing that's gratifying to us at CodeBlueNow is that they thought if there was a group, a nonpartisan organization of everyday people just like them, maybe with some few elder statesmen and some experts who are healthcare professionals, they might trust that organization. But I wouldn't trust it unless I could look them in the eye.